the Nanodosed Podcast.
The Nanodosed Podcast.
Welcome to another episode of the Nanodosed Podcast. Yes, this is the Nanodosed Podcast. You know I am your host, Ashiva, and this is the podcast where you get a dose of effective adulting. I am so excited today. I'm excited because I have a wonderful host joining me. It's a pre-recording and I will give you all the details about my guest in that recording. His name nonetheless is Dr. Mudit Verma, and he was so willing, so inclined to join me here on this episode. Guys, we're talking about depression today, and this is a big topic. I realize nowadays that a lot of persons are capitalizing on this topic of depression because we realize that regardless of the age group, everyone is being affected by this disease one way or the other. And so Dr. Verma joined me to really explore this topic. We explored his experience, and we just want you to be a little bit more mindful of this conversation and this topic at large. So you can find Dr. Verma on all socials at I like to Mudit. That is, I like the number 2 Mudit, Mudit. I like to Mudit. And as for the Nanodosed Podcast, you can find me as well on Twitter and on Instagram at Nanodosed. That is Nanodosed, Nanodosed Podcast. We're also on all podcast platforms, so you can always check me out and listen to all the other episodes that were previously recorded. Remember as well to rate this podcast on Apple Podcast and to leave your comments if needs be. Thank you so much for just rocking with me and being Nanodosed. I appreciate you guys. I say that every week, and I will forever say it in every one of my episodes. I will not be here if it wasn't for my dedicated listeners. So thank you once more for listening to me week after week. Nonetheless, guys, we're going to get right into the conversation. I hope you enjoy. I hope you're uplifted by the end of the conversation. I hope you are even so permitted to continue having this conversation within your closets, among your friends, in public, to the general audience of whoever you're speaking with. Continue talking about depression. It's affecting everybody, and we all need to be aware. Have a listen, guys, and please do enjoy. Hi, everyone. Welcome to the Nanodosed Podcast. I am, of course, your host, Ashiva, and we are on the topic of depression. Now, with me today, I have a very special guest. Can I tell you that he's a psychologist? He is a mental health advocate and the Doctor of Pharmacy graduate from the University of Maryland. Now, if you think I'm done, I'm not yet done. He's a podcaster, he's a YouTuber, and he is a comedian. Now, please help me welcome Dr. Mudit Verma. Dr. Verma, thank you for joining me today.
Thank you so much. I'm super thankful to be here.
Yes, absolutely. Now, I mentioned that you're a psychologist. My first question to you, why psychology and why advocate for mental health?
Right. So in my undergrad in college, I came into college wanting to, if not being expected to, major in biology, particularly molecular biology. My parents are PhD trained scientists. My father in biochemistry and my mom in chemistry. Yeah, and essentially I took a course in psychology my very first semester, and I was the most interested in that particular course. It was a social psychology course, and there were several things going on, or there's some things to unpack with that particular course and its timing. I was taking introductory level chemistry courses and biology courses during that first semester. They were very challenging. But with the psychology course, I took an exam in high school, which allowed me to take sort of a second year level psychology course during my first year. And what was interesting is that I think, despite maybe chemistry and biology having more minutia, having more details, there was a sense that maybe the psychology course should have been more competitive or challenging, but it was welcoming, and it was healing,
Right.
and it was a community of sorts, like my classmates, the professor. Whereas like in the introductory courses for chemistry and biology, it's like, despite the learning curve, the inevitable learning curve of like a very detailed science, I felt that the energy and the attitude and the emotional climate were all, from my perspective, very negative and sort of needlessly toxic and unwelcoming. And so I chose my undergraduate degree to be psychology, while simultaneously taking the courses I needed to take to pursue pharmacy school, which came from a bit of a cultural lens, and with my family in particular. My parents really wanted me to go for medical school, but the thing with the medical school paradigm is that both the profession, the lifestyle of the profession, and the lifestyle of being a medical student, I knew I would not have been able to sort of handle it and take care of my own mental health. And so that's sort of where pharmacy kind of became the outcome there. And perpetually throughout college and pharmacy school, I've advocated for mental health in every way I can. And I think, just to maybe wrap up that particular like intro part, is just like, in pharmacy school, it was very challenging. I have to say that I did graduate, I did finish the degree, but there is a lot of
Challenging.
right. And I also think actively be honest and transparent and blunt, perhaps. Like, there's a level of regret with my choice of pharmacy school, but the issue is it wasn't, with the cultural kind of nuance to this, the idea of choice is not quite existent as maybe as maybe for other cultures, or so yeah, that's my story at a glance.
Okay. And let's just tap into depression. We know the mechanism really of depression. It basically, from the monoamine deficiency theories, we know that it possesses underlying pathophysiological basis where neurotransmitters, serotonin and norepinephrine of the central nervous system, they are released from the blood. So could you explain what the term depression is an illness really means, and explore what captivates you when you hear that statement?
Right. I think that the first thing I want to say is, although I have a bachelor's in psychology and a doctorate in pharmacy, I don't practice. I don't see patients. And my first job after graduating pharmacy school was a research position as a medical writer for a clinical trials group. And it was not patient facing nor client facing. I was behind the scenes putting together recommendations from like ongoing clinical trials for perhaps like new medications. And this, I think it ties in. So the best thing I can do in this conversation is perhaps like share my personal experiences, and they happen to be personal experiences while like simultaneously having been, I guess, trained and educated in the field. I guess it's not crossing into the area of actually practicing, almost precisely because I have a level of anticipation or preliminary familiarity of like the demands of being a practicing professional that actually sees patients and clients. So, what comes to my mind is that, as you mentioned and defined, I found that to be comprehensive and largely accurate. I've been diagnosed with bipolar disorder, and what prompted my bipolar disorder diagnosis was actually a long manic episode. And the psychiatrist believed that the reason I had that manic episode was because I took a medication that was supposed to treat anxiety, but because I may have had a pre-existing depression, which I didn't maybe bring up to them, that prompted a sort of labile mood and then eventually a manic episode. So on top of all of that, there's this level of, I guess, depression that's tied to like having bipolar disorder, and depression being one of the ends of that disorder, and mania being on the other end. I have been diagnosed with seasonal affective disorder, where in the fall and winter, I live in Maryland, just outside of Washington, D.C. I can definitely feel symptoms in the fall and winter, that pronounced symptoms and like greater severity of depression in those colder seasons.
So I see you mentioned you had a pre-existing condition of depression, right? And I know that bipolar disorder, they both have the same symptoms. So how hard or easy was it for your practitioner to, say and diagnose you with the correct illness?
I think that it took me a long time, and I still have questions to this day, maybe just like questions or areas of needing clarification, I guess. Is like, it took me a long time to trust the process. But the thing is, healthcare in the United States, like, it's actually legitimately fine to scrutinize it, and that it's like there's concerns surrounding like maybe like profit-driven nature of why the infrastructure is the way it is, and like the outcomes not matching the healthcare outcomes, or the health quality of life outcomes not being consistent with economic outcomes. What I want to say is, like, I found that every time I see a provider in the mental health space, whenever I saw a psychiatrist in particular, a psychiatrist as opposed to a therapist, counselor, or a psychologist, I found psychiatrists to be very quick, very fast, very quick, very concise, and not really in the most favorable ways at times. And I guess, diagnosing and assessing me, diagnosing my mental health issues, and then prescribing a treatment, and like the trial and error nature of psychiatry in particular, when there's prescription of medications involved, I found to be literally like grueling, because I've through prescriptions, like I've tried many medications, many of them failed. And I just don't have that very visceral experience, literally a visceral experience with literally every type of therapy or counseling, or essentially non-pharmacologic therapies or interventions for my mental health issues. So it's the quickness, and it's like in terms of how easy or hard, I feel like it's hard on me, but easy for them. It's like a trial and error. Like, oh, this didn't work. For them, it's like the side effect of getting a rash, like a full-blown body rash because it's medication. It's like the word rash is only 4 letters long, and to them that's all it is for like their notes. I mean, I don't know. It's like I can't blame them because they have to move through patients and stuff. But it's like, but I'm the one experiencing it. Whereas with literally any other non-pharmacologic intervention, with like CBT or any talk therapy or any like psychology, which I'm not, having gone through pharmacy school, I've kind of lost a little bit of touch with like the details of the distinguishing factors with the non-pharm therapies, but like there's more of a drive to get to tailor treatment for the patient and not do this like gruesome trial and error. So yeah.
Even so, how hard was it dealing with their trial and error?
Yeah, it was hard. I have a lot of flashback. I've taken a medication that prompted a rash. Even medicines, like I took a Abilify at one point to manage bipolar. This aripiprazole. And what's interesting is like some of these medications, or a lot of them rather, have weight gain as a side effect. And some of the medicines have like greater weight gain side effects than others. But even something as, I guess, what's seemingly trivial as weight gain compared to, it's just like other side effects of medications. That was like, I was essentially gaining weight, and I don't know, I felt more sluggish. And what was something that seems so trivial on paper, compared to other maybe side effects, like maybe someone goes into anaphylaxis or has this like huge body allergy reaction, like that was enough to really disincentivize me to take it. And like I spoke to my psychiatrist saying like, I really am not comfortable, existentially with this side effect of weight gain. So it just all around not particularly enjoyable. And I think that the system, or a lot of these side effects and the risks, potential side effects, they can be behavioral in nature, and they can be very scary, and they can even worsen the condition. I mean, that's often written in the literature, the label or handout. And I don't know that that society or the system, but there's not a built-in kind of level of like, I'm the one that has to absorb the emotional cost of this trial and error. And there's no like my employer or my professor, if I was in school, would not necessarily be able to accommodate for that. And if they are, I'm still to this day not fluent in like what office for disability advocates, or like that minutia still intimidates me to this day. Like sometimes I don't know who to call. And if I do know who to call, there's like a waiting period for accommodations to occur. Like this is a big theme. The bulk of my mental health issues during pharmacy school occurred towards the latter 2 years of the program. And I had very little patience and kind of like mental bandwidth to essentially make these phone calls, set up arrangements while also studying for class. My parents wanted me to like finish the program all the way through without taking a break. Essentially, I got overwhelmed and had to continue doing what I was doing. I guess I graduated on time, but this stuff catches up to me. Especially with this pandemic, there's a lot of time spent in my head with this pandemic. And so yeah.
Yeah.
kind of hard.
Yes, I'm very happy you mentioned the pandemic because I was doing a little reading a couple of days ago and I actually found out that depression has actually increased throughout the pandemic. So has the pandemic has an effect on you since, it started?
Yeah, absolutely. And I mean, thankfully, because it's been so long, because we're on like month number 9, I've figured out how I can best manage and best get used to it. The fact that I'm saying that is sad in the sense that going into the pandemic, we didn't think that this was something that we had to learn how to get used to because we all thought that this would be sorted out and reconciled.
Oh,
So,
yeah.
absolutely, this was very hard. The beginning was extraordinarily hard. I pursued stand-up comedy after leaving my first research job since their company moved very quickly from my home state, which is Maryland, to Florida. I was not in a position to relocate. And I finally wanted to take time off. I wanted to take time off for myself, something to the effect of a gap year, maybe not necessarily traveling, but essentially my deep dive into stand-up comedy was kind of that time off that I craved. And I wanted to specifically attempt comedy when I had enough mental bandwidth where I was not in school and not like working, because I think, I don't know, the creative demands or just the learning curves. Like I tend to do better on pursuits, whether they're artistic, academic, or whatever it may be, when that's the one thing I can focus on. So long story short, comedy was going fantastic until this pandemic hit and everything shut down.
Yeah.
And it sort of, it was very hard because it kind of ruined the cadence of this time off that I was taking. In this time off, I volunteer part-time for a South Asian mental health nonprofit, and it has landed me a very few paid freelance writing gigs. But the point is, I'm still not full-time employed. I'm like hunting for jobs now. Aggressively hunting for paid full-time positions. And when this pandemic hit, all of stand-up comedy stopped for obvious reasons. You can't have live performances. We did, as a global stand-up comedy community, we did pivot a little bit into Zoom, which actually has been really good for networking. We kind of tell each other jokes on group Zoom calls and take turns as we do, and like an open mic kind of setting, like at a comedy club or venue. I think that's the silver lining with the Zoom, with the online comedy, has been the networking. And as someone that's really new to comedy, that there's still some fulfillment to be had with just kind of writing jokes, structuring jokes, learning how humor is created based on the words. And then, it's like this intermediary before getting on stage where you're also using your gestures and whatnot. But that's just kind of dissecting the silver lining there. But again, the pandemic just ruined kind of the cadence of this time that I took off, because the plan was for me to like develop my comedy skills, maybe job hunt in like New York City or Los Angeles, those two areas being like the entertainment hubs. And and maybe like, I don't know, like either work a part-time job to pay rent over there, or like find a full-time job that relates to my pharmacy credentials and or my psychology degree credentials. Like but the idea, the driving force was comedy, the passion. And that's kind of like, that may or may not speak to another struggle of identifying a compatible occupation and then realizing that it tends to only manifest as a hobby. And what I'm referring to is like comedy versus, being a pharmacist versus being a psychologist, or versus, having a career that is much more oriented to, like stable day job hours and benefits and things like that. So yeah.
Okay, awesome. I actually checked you out on YouTube, and yeah, you had some good jokes over there. So I
Thank
see
you.
that, yeah, no problem. It helped by basically the management of your depression. So apart from comedy, what other management therapy do you have?
Right. Speaking for myself and what helps me in particular, I would characterize this maybe as like a self-care regimen. Actually, no, before I get to self-care, I'll tell you the professional resources I seek right now. So every other Monday at noon local time, I do see a therapist via Zoom. And some things I want to say about that is that when I changed jobs, or when I left my first company, like that had implications on my health insurance changing, right? And when your health insurance changes, then that has implications on your providers, in the sense that, how expensive or not is the copay, and do they take insurance or not? And so that kind of creates this additional barrier and hurdle and obstacle in the whole process of seeking a provider, gauging if it's like from a mental health and clinical standpoint, gauging how compatible that provider is with you, maybe like culturally, maybe personality wise. Then you have to do this nonsense of gauging of, do they take your insurance, which is completely not related to the clinical aspects of treating mental health. That's purely a financial thing. So healthcare infrastructure, when you put private insurance companies, is already annoying because when there are multiple entities involved, that's like, there's additional red tape, additional logistics, additional time and energy being spent, aka wasted, on just one insurance company communicating to another when the customer has to change because of like a career or job implication or anything. Like it's like this needless layers of complexity that do not pertain, if not harm, like it actually harms, like kind of like mental health, just from like not being able to streamline the delivery of services and access to services. So the point there is I'm essentially leaving like voicemails to all kinds of mental health care providers, whether they're counselors, therapists, psychologists. In the voicemail, I tell them my contact info. I tell them my insurance information, which my parents have graciously supported me with. They're paying for my health insurance now. And then, I essentially wait for them to get back to me when they're available and wait for them to get back to me to see if the health insurance is covered. And so there was a couple of months where I had to play this phone tag and voicemail tag and just just stick it out. Like I had to like stick it out until I could get like a first appointment and do what I know could reliably work. So when the weather was nice, I would take like obnoxiously long walks outside, during the day just to like cool off. When the pandemic started, I think my symptoms were more on the manic side of like bipolar. And also it was like, spring was coming. So that kind of, for me personally, there are parallels there. And then when the weather gets cooler with like seasonal depression, like that stuff gets pronounced. And so there was this like level of like agitation and like being annoyed, existentially annoyed, and like mania. Like my mind was racing because it's like the pandemic. It was just frustration is a word that characterized it. I finally secured a healthcare. I mean, like a mental health care provider, this therapist that I see every other Monday. And what's interesting is like he's pretty decent. He's not perfectly compatible, and like I could even make the determination that there's probably better providers out there. But the point I want to make is that I stick with this therapist simply because it was such a nightmare getting a hold of one that was simply available. So, like I don't have options here, and from like a time and availability standpoint, it is clinically important to find a therapist that is right for you. But I am sad to say that as a person consuming, mental health care that I need, like I felt like I've had to settle, because of the circumstances. And so to wrap that up, it's like I exercise daily. I'm very good with exercising daily. That just generally has good outcomes for me. Cardiovascular exercise in particular helps me out the most, and just like getting leveled. Something I have a bad habit of, and I own like responsibility of this, is like my sleep habits are awful, and this is on me. Like I essentially go to bed late. I'm a night owl. I mean, being a comedian, it's a nighttime thing. We're never really doing this 9 to 5, unless it's for like a corporate, which would be kind of cool. But yeah, it's a nighttime thing, and so I'm trying to discipline my own self with just getting to bed sooner. What I have done a good job with is I've been very particular about kind of my sleep environment, where there's no light, residual light in the bedroom. I'm very particular about like the choice of blanket and pillow covering. So for me in particular, like my body gets very hot, and that can disrupt my sleep. So I choose like materials that are cooling. And sleep is super important because that has implications on like the mood the next day, and it's a cyclical thing. It's an inevitable cyclical thing that is sleep. So the exercise, sleep. This sounds cliche, but it's just I try to be mindful of like if I'm on social media, which is a big part of comedy and like self promotion, I make sure that I'm on there with intention and with a mindset of like productivity, as opposed to like mindlessly scrolling and being kind of maybe like hypnotized by like the social media feed. So having a mindset of like producing social media content for my like comedy stuff, as opposed to like mindlessly consuming it. I will support my friends and artists and whatnot, but with intention, to kind of keep mental health in check. And that's sort of my strategies and kind of routine. And yeah.
You're also saying that in a nutshell that having a routine helps with the management of depression.
I would say so. Yes.
Yes. And in relation to social media, how important is guarding yourself? Because I heard you mention that, you're very intentional in what you do on social media. And I want to ask you, how effective is that? Because even so, sometimes we can see something of our interest that can get us distracted from our main intention. Right. So how do you keep yourself balanced when you're on social media?
Yeah, I think I can maybe go through each platform that I'm engaged with, because there's some apps that there are moments I have with certain apps that were really bad for my mental health, and there are other apps that just don't carry that risk. And I'll start with the most problematic ones. Twitter in particular, it's very like, the way Twitter works is it's very text heavy, and it's like very like 1 to 2 to 3 line heavy, like quick responses. And so there's like a lot of clapbacks. There's a lot of like debates, a lot of arguments. And like there's a lot of like passive aggressive cadence to it, which means like, and this is big in comedy. I mean, roasting is a big part of comedy, right? So there's like, it's like not only are people like replying to tweets, but they're actually trying to get you. Sometimes it's in the medium of humor. Sometimes it's not in the medium of humor. Maybe they're genuinely trying to like clap back at you. And that's the rabbit hole. Sometimes I get so deep into what should have been maybe like a political discussion or policy oriented discussion on maybe like a political topic. And it's just, it becomes like a contest of like comedic clapbacks. Like one tweeter like uses this meme to clap back against that person, and then they use like this GIF and then make this joke. But it gets toxic at a point. So my relationship with Twitter, the solution is simply distance. I mean, there's no way around that. It's like, and actually maybe there's like a silver lining to having multiple apps is like, so I have a historically bad relationship with Twitter. I'm not going to delete it per se, but I just keep quiet on it and I let that sit. And then on Instagram, I don't know so in 2019, in the fall of 2019, for users of Instagram in the US, there was an update on our app, and maybe this is true for all of Instagram now. I'm really not sure, but there was an update where the number of likes was changed in the sense that you could not see the number of likes on a picture other than your own. And it would just say like tiers of magnitude. This person and others like this photo. So it doesn't give you a number unless you're in the thousands. So it's either just 0 and others, or just like others. It's thousands of people and others, or it's maybe like tens of thousands of people and others and like millions. So it's like, for me, it's like my Instagram post, at most would get like 100, maybe 200 engagements, usually like 40 to 50. And neither of those figures are anywhere close to 1,000. So that actually, and this was a good thing, at least in my opinion, that very nuanced step or decision by whoever was in charge of Instagram, despite being owned by Facebook, was that liberated me to like be more creative on Instagram without fearing judgment. Cause I was nowhere close to the 1,000 threshold. I was like, so that like liberated me to just like freely exist on Instagram without judgment. And that's persisted to this day with Instagram. So I have like a healthy relationship with Instagram. With Facebook, I used to have a big problem. Facebook's been around since like the mid 2000s. And for the first decade and a half of me using Facebook, mindlessly scrolling through my news feed was a big problem. And thankfully that's changed in the past few years, both because of personal changes with like, being intentional on all social media. Like now I have something to promote. When I started comedy, it's like, to me, that's something of so much substance that I have a reason to promote it, and not have it be this thing where maybe like when I had my research day job that like I wouldn't post any social media posts about work. First of all, that's not really advisable. I mean, my work was not exciting. It was like client facing stuff, like client company facing stuff. It's not like consumer facing, nor patient, nor facing stuff. So the point is, it was boring stuff. So it's like the only thing I could post about is like random vacations at concerts I went to. But I'm not the one producing that art. Like when going to a concert, I'm consuming it, right? Which is, it's not as substantive as me like self-promoting my comedy. And Facebook is a really good tool for arranging events, organizing events, open mics for comedy, showcases for comedy, panels. So making the events and the groups as opposed to the mindless like news feed and the mindless maybe like friend requesting. I think Facebook is a lot healthier when it's conceptualized being a member of a Facebook group of a common interest and being an event planner or an event attendee as say a comedian or whatnot. Those are the apps that I'm on. I use LinkedIn to apply to jobs. I don't really have a problem with LinkedIn. Just maybe I'm really like gunning for these job applications. So that's been kind of tricky just navigating through interviews. But I will say that sometimes this is like a really kind of odd or somewhat dystopian, but like sometimes I catch myself scrolling through LinkedIn with the same way I used to scroll through like Facebook or something. So that's been kind of interesting. But yeah, that's my story with social media.
Oh man, don't worry about that because boy, we have a couple things in common. I do that all the time. And I was like, oh wow, I like her accolades. Oh wow, she's so successful, and I
Mhm.
commend persons for what they're achieving so far.
Right.
Right. And Dr. Verna, we're about to wrap this episode up. And before you leave, I just want you to give our audience advices as to how they can manage their depression, especially in this pandemic, because ultimately, we want to help other persons in their management and we want to reach to other persons who really don't know what to do or the first step to make. So, what advices would you give to persons managing depression right now?
Definitely. I'm very glad you asked this question. My advice is to do your best to take steps in seeking professional treatment. And I mentioned earlier that for me, there was a lot of downtime. And I also mentioned that for me, there was some struggles in trusting kind of the credibility of some of the medication therapies. And a lot of
Mhm.
my opinions and scrutiny are valid. So it's, you should be seeking professional care, but it's also important to be comfortable with what kind of care you are receiving. It should be an equitable relationship between you and the healthcare provider. And the way to gauge like the quality of said professional care is like, determine what works best for you in terms of maybe like the type of licensure, the type of therapy you seek, maybe talk therapy versus medication therapy versus any other sort of like behavioral therapies. Like try to anticipate maybe what you imagine would work best for you, and then seek out providers from there, and then gauge the quality of those providers. Like if you have concerns or questions about the quality of the care, speak up about those questions as opposed to maybe like don't feel like you're in a position where you'll offend the provider if you ask them a question that maybe contests their judgment or knowledge or degrees, because their job is to educate the patient and educate in a way that is transparent, that is equitable, that is supportive. So taking those steps to seeking professional help, coping the best you can, because for me and many, there's a lot of downtime. There's a lot of waiting time between maybe the first email or the first phone call or the first voicemail to like the follow-up phone call or the follow-up voicemail. And not all of your problems are solved in the first session or the second session. I mean, it's a process. Healing any disease is a process. So taking that first step is what I advocate for, and then taking the subsequent steps as well, and sort of committing to the process as best as you can. Finding like-minded advocates, finding like-minded caregivers, distancing yourself from folks that maybe even if their heart is in the right place, but if being around them for one reason or another is not helping you, just see if you can facilitate some distance. I mean, being as steadfast with your own well-being as the best you can, leaning a little bit into that selfishness, because that's kind of what gets us through to these tough times, and that's my advice.
Wow, thank you so much. Good advices. And I hope persons listening, they jot a little things down, jot even everything that you mentioned, because, I'm sure it will help somebody somewhere. And might I add I have a lot of Jamaican listeners, and here in Jamaica, depression is not treated as essential and as urgent as it should be treated. And even around the world, we can just imagine.
Mhm.
But here in Jamaica, it's overlooked and it's just looked upon as sadness, and you'll get over it in
Mhm.
time. But it's time for us to really address this issue and really get to the bottom of it so persons can live a happier and ultimately a healthier life. So ultimately, I really want to thank you so much for joining us here today. We enjoyed your story. We are enthused by it. We're empowered by it. And I hope we can still keep in touch moving forward, in the future, because you never know. So thank you once more for joining me here on the Nanodose podcast.
Thank you so much. I really appreciate it, and I will definitely keep in touch. Thank you.